May I invite Sudan to speak?
Thank you. Thank you, Chair. Honourable Chair, distinguished delegates, Excellencies. Sudan commends the Director General report on the prevention and control of non-communicable diseases and acknowledges the efforts exerted by WHO for promoting access to affordable diagnostics, screening and early diagnosis as part of a comprehensive approach. We emphasize the importance of prioritization of early detection. To that, we call for joining efforts in strengthening capacity for early diagnosis, screening and appropriate treatment. Sudan is no exception from the international trend of transition of the disease's pattern from predominantly communicable to non-communicable. In recent years, the top 10 causes of death in my country included asthma, a stroke, heart diseases, hypertension, and diabetes. However, data on diseases burden of NCDs were scarce and deficient till 2016 when the National Stepwise Survey was conducted. However, the need is still high for stronger action in support of the provision of baseline data for NCDs and their related risk factors. As Sudan commits to WHO's Global Action Plan for the Prevention and Control of Non-Communicable Diseases, Sudan succeeded in inclusion of NCDs management as one of the components of the basic PHC package through availing the diagnostic services and medicines. Effective strategic directions and necessary adequate funds to facilitate the prevention of NCDs are essential. Institutional, community and public health changes are required to be incorporated within the long-term and life course perspective. Despite all efforts exerted, addressing NCDs remained a multifaceted challenge in my country. Although international donors currently cover most of the preventive health interventions, it is not always possible to direct funds towards a national strategic drives. Donors are still interested in supporting combating communicable diseases, irrespective of the burden of other diseases in the targeted countries. In this regard, we urge WHO and donors to be mindful of the significance of prevention and control of NCDs, and we call for further steps to be taken to ensure the need for hospitalization and costly high-technology interventions, as well as premature deaths, are reduced and complications are prevented. I thank you, Chair.
Thank you very much.